Hello friends of Klik Insight. It is necessary to know the 10 deadliest diseases that exist in this world. This list may differ depending on the specific country and population, and the ranking may change over time due to changes in trends and disease prevalence rates. 1. Heart and blood vessel disease. Cardiovascular disease is a term used to describe a group of conditions that affect the heart and blood vessels. These include problems such as coronary heart disease, blockage of the arteries that supply blood to the heart, hypertension, high blood pressure, peripheral vascular disease, problems in the blood vessels around the heart and other organs, and stroke. Coronary heart disease is the most common form of heart and blood vessel disease. This occurs when plaque builds up in the blood vessels that supply blood to the heart, causing blockages and restricting blood flow. This can cause a heart attack or angina, chest pain. Hypertension is a condition in which a person's blood pressure exceeds normal limits, which can burden the heart and blood vessels. Without effective treatment, hypertension can cause damage to the heart, kidneys and other blood vessels. Peripheral vascular disease is a problem with the blood vessels around the heart and other organs, such as the veins in the legs. This can cause pain, cramps, and even loss of sensation in the feet. Stroke is a condition in which blood flow to the brain is disrupted, either due to a blocked or burst blood vessel. This can cause permanent damage to the brain and affect bodily functions such as talking, walking and holding objects. Diseases of the heart and blood vessels are very deadly and are the leading cause of death worldwide. Preventing and treating this condition through a healthy lifestyle, medications, and medical interventions can help reduce risk and extend a person's life. 2. Cancer. Cancer is a group of diseases caused by uncontrolled cell growth in the body. Cancer cells can spread and affect other organs and tissues, endangering one's health and threatening one's life. There are various types of cancer, including breast cancer, lung cancer, colon cancer, prostate cancer, cervical cancer, and liver cancer. Each type of cancer has different signs and symptoms, as well as different treatment methods. The exact cause of cancer is still not fully known, but risk factors include age, family history, lifestyle, and exposure to chemicals and radiation. Symptoms of cancer can include pain, enlargement of the mass, changes in bowel or bladder patterns, and changes in skin conditions. Diagnosis of cancer usually involves a physical exam, laboratory tests, and imaging tests such as a CT scan, MRI, or PET scan. Cancer treatment usually involves a combination of therapies, such as chemotherapy, radiation and surgery. Depending on the type and stage of the cancer, other possible treatments include targeted therapy, immune therapy, and hormone therapy. Preventing cancer through a healthy lifestyle, such as avoiding smoking, eating a balanced and nutritious diet, and exercising regularly, can help reduce your risk of developing cancer. Early finding and prompt treatment are also very important in improving the prognosis and prolonging the life of someone with cancer. 3. Stroke. Stroke is a serious and deadly disease. This is a medical condition in which blood flow to parts of the brain is blocked or cut off, causing damage to brain tissue. Strokes can cause permanent physical limitations, speech problems, and memory problems. There are two main types of stroke: ischemic and hemorrhagic. Ischemic stroke occurs when a blood vessel to the brain is blocked by a blood clot or plaque, blocking blood flow to brain tissue. Hemorrhagic stroke occurs when a blood vessel bursts and allows blood to flow to the brain, causing damage to tissue. Risk factors for stroke include older age, family history of stroke, hypertension, smoking, drug use, and other health conditions such as diabetes and heart problems. Symptoms of a stroke include weakness or loss of control of the face, arm, or leg on one side of the body, difficulty speaking or understanding language, loss of balance or coordination, and a sudden, severe headache. Stroke diagnosis can be made through a physical examination, blood tests, and imaging tests such as a CT scan or MRI. Early screening and prompt action are critical to reducing damage to brain tissue and improving prospects for recovery. Stroke treatment depends on the type of stroke and the degree of damage to brain tissue. Some of the treatments include administering drugs to improve blood flow to the brain, surgery to remove blocked blood vessels, and physical therapy and treatments to help individuals restore lost function. Stroke prevention includes a healthy lifestyle, such as controlling blood pressure, maintaining an ideal body weight, avoiding smoking, and controlling health conditions such as diabetes and heart problems. 4. Diabetes. Diabetes is a metabolic disease caused by a lack of insulin production or a disturbance in the body's use of insulin. Insulin is a hormone that helps move sugar from the bloodstream into cells, where it is used as a source of energy. There are two main types of diabetes, type 1 and type 2. People with type 1 diabetes need regular insulin because their pancreas does not produce any insulin at all. People with type 2 diabetes can produce insulin, but not enough or their bodies are unable to use it effectively. Symptoms of diabetes include excessive thirst, frequent urination, and excessive hunger. In addition, people with diabetes may also experience fatigue, weight loss, and frequent infections. Diagnosis of diabetes involves a blood test to measure the level of sugar in the blood. Diabetes treatment includes blood sugar control, a balanced diet, exercise, and in some cases, medications or insulin. Preventing diabetes through a healthy lifestyle, such as maintaining an ideal body weight, exercising regularly, and eating a balanced diet, can help prevent diabetes. Early finding and effective treatment are also important in preventing serious complications such as vascular damage, kidney damage and blindness. 5. Lower respiratory tract infections, e.g. pneumonia and bronchitis. Lower respiratory tract infection is the term used to describe infections that occur in the lower parts of the respiratory system, such as the bronchi or lungs. The two most common types of infection are pneumonia and bronchitis. Pneumonia. Pneumonia is an infection of the lungs that can be caused by bacteria, viruses, fungi, or parasites. Symptoms that often appear in pneumonia include fever, cough with phlegm, chest pain, shortness of breath, and sore throat. Pneumonia can spread by airborne droplets or by contact with a sick person. Bronchitis. Bronchitis is an infection of the airways that carry air to the lungs. Bronchitis can be caused by viruses or bacteria and symptoms include cough with phlegm, shortness of breath, sore throat and fever. Bronchitis is usually accompanied by excessive mucus production and can be spread by airborne droplets or by contact with a sick person. In both types of infection, the immune system usually plays an important role in overcoming the infection. However, in some cases, these infections can become serious and require medical treatment. If you have symptoms such as high fever, shortness of breath, or chest pain that lasts more than a few days, you should seek immediate medical attention to ensure that you do not have a serious lower respiratory infection. 6. Chronic kidney disease. Chronic kidney disease, CKD, is a condition in which the kidneys experience progressive and irreversible damage over a long period of time. Kidney damage can occur due to various factors such as diabetes, hypertension, kidney infections, and blood vessel problems. Chronic kidney disease usually has no obvious symptoms in its early stages, but symptoms can appear when the kidney damage is very severe. Some of the symptoms that may appear include decreased appetite, impaired ability to speak, frequent urination, swelling of the limbs or face, fatigue and weakness, pain in the lower back or sides. Chronic kidney disease can spread throughout the body and cause serious health problems. Therefore, it is important to have regular checkups to ensure that your kidneys are healthy and to treat problems early if there are any abnormal symptoms. Treatment for chronic kidney disease usually includes controlling blood sugar and blood pressure, treating infections, and maintaining a proper diet. In some cases, a kidney transplant or dialysis may be needed. 7. Chronic liver disease, CLD, is a condition in which the liver experiences progressive damage over a long period of time. Chronic liver disease can be caused by various factors such as hepatitis virus infection, alcoholism, obesity, and autoimmune diseases. In its early stages, chronic liver disease has no obvious symptoms, but symptoms may appear when the liver damage is very severe. Some of the symptoms that may appear include decreased appetite, fatigue and weakness, abdominal pain, swelling of the abdomen, nausea and vomiting, dark urine, light-colored stools, yellowish skin and eyes. Chronic liver disease can spread throughout the body and lead to serious health problems such as cirrhosis, permanent liver damage, and liver failure. Therefore, it is important to have regular checkups to ensure that your liver is healthy and to treat problems early if there are any abnormal symptoms. Treatment for chronic liver disease depends on the underlying factor and may include controlling alcohol, treating infections, and maintaining a proper diet. In some cases, a liver transplant may be required. 8. HIV/AIDS infection. HIV/AIDS infection is a disease caused by the human immunodeficiency virus, HIV. This virus attacks the immune system and makes the body vulnerable to infection and disease. If left untreated, HIV infection can spread and develop into AIDS, acquired immunodeficiency syndrome, a condition in which the body's immune system is severely eroded and the body is very vulnerable to infection and disease. The HIV virus can spread through blood, sexual fluids, breast milk, and from mother to fetus during pregnancy, childbirth or breastfeeding. Some of the symptoms that may appear in the early stages of HIV infection include fever, shortness of breath, sore throat, headache, fatigue, decreased appetite. These symptoms are similar to those of other viral infections, so many people are not aware that they have HIV. However, even though there are no obvious symptoms, HIV infection continues to grow and spread throughout the body. Treatment for HIV/AIDS infection includes antiretroviral therapy, ART, which is treatment with drugs that help slow the development of the virus and maintain a healthy immune system. ART cannot cure HIV infection, but it can help prolong life and improve the quality of life for sufferers. Prevention of HIV infection includes vaccination, use of sexual condoms, and blood tests to make sure you are not infected. If you think you are at risk of becoming infected with HIV, get your blood checked immediately and take action as soon as possible to slow the progress of your infection and maintain your health.